Hi everybody, this is the video for my disability pamphlet, and I did my disability on fetal alcohol syndrome. Fetal alcohol syndrome now falls under a broader category called fetal alcohol spectrum disorders, and it includes a variety of disorders that affect a child who has been exposed to alcohol in the womb. It includes fetal alcohol syndrome, but there is a lot of milder symptoms that children may have who have had maybe less exposure to alcohol, or more severe symptoms if they've been exposed to more alcohol in the womb. Approximately 40,000 infants are born each year with fetal alcohol syndrome, and it affects almost all areas of functioning, which I'll get into in just a moment. To prevent fetal alcohol spectrum disorders, basically a woman should not be drinking if she is pregnant or if she believes she may be pregnant. It can take 4 to 6 weeks before a woman may even know if she's pregnant. So if you're trying to get pregnant or there's any chance that you may be pregnant, it's best just to stop drinking altogether. The sooner a woman stops drinking, the safer it will be for her and her baby. So if she was drinking and maybe didn't realize she was pregnant, the sooner you can stop, the healthier your baby will be. Signs and symptoms include abnormal facial features, small head size, shorter than average height, low body weight, poor coordination, hyperactive behavior, difficulty with attention, poor memory, difficulty in school, especially with math, learning disabilities, speech and language delays, intellectual disabilities or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby, vision or hearing problems, and problems with the heart, kidneys, or bones. So there are a lot of issues. The cognitive delays will affect motor sensory, attention, language, visual spatial abilities, learning and memory, problem solving, and overall intelligence. So again, those delays can range from mild to severe, and it just depends on how much the mother drank while pregnant and how the fetus processed the alcohol. Fetal alcohol syndrome lasts a lifetime. There's no cure for it, but there are things that we can do as special education teachers, as well as things parents can do to improve the child's development and help them reach their full potential. So as most of you probably know, reaching out to your early intervention service providers is going to be a huge component for helping your the child's development. There are also what they call protective factors that can help reduce the effects of fetal alcohol spectrum disorders. That includes diagnosis before 6 years of age, living in a loving, nurturing, and stable home environment during the school years, an absence of violence, and involvement in the special education and social services. So it's really important that families with children who have a alcohol spectrum disorder get those services right away, and I've listed several resources on my pamphlet as well for that. If you need help, please get help. You can go to Alcoholics Anonymous if you need help to quit drinking. There are other resources that I've listed on my pamphlet. Or if you already have a child with a fetal alcohol spectrum disorder, talk to your doctor, and he or she can refer the family to a specialist. You can also find doctors in your area by visiting the National and State Resource Directory, which I have a link to on the pamphlet as well, and calling your state's early intervention program and school district, depending on how old the child is. So although this is a lifelong disorder and it can greatly affect the development of child, there is help to help them progress to their full potential. Thanks, everybody.